Welcome back to the show. There's a very interesting study happening here in Peel Region called Laser-Enhanced Spinal Decompression. It has to do with chiropractics, and we have Dr. Mark Jagger here to talk to us all about it. How you doing?
How are you, doctor?
Good. We have a very interesting device on the table. I'm sure that has to do with the laser-enhanced spinal decompression. But first, tell us what exactly that means.
Okay, laser-enhanced spinal decompression is a new therapy available for those suffering from neck and back pain. It takes two of very highly revered therapies for neck and low back pain, other sports injuries and such, non-surgical spinal decompression, and also laser therapy, to combine them together to get the effects of both.
Wow, and how exactly does it work? Because you did bring along, of course, a machine here with you, and I'm curious if you can kind of walk us through exactly how the decompression works.
Yeah. Well, spinal decompression itself is designed generally for people with disc herniations, disc bulges, sciatica, things where the spine has aged or become injured in the sense of the bones become closer together and basically squash the disc. So what we've done, taking the spinal decompression itself, spinal decompression just basically gets the height of the disc back to where it should be, and if there's any material that should be inside the disc that has been squashed out by the decrease in spinal height, the decompression replaces that fluid back into the disc. Then the second part of that is with our laser unit here. What we found with spinal decompression generally is that very good results, except for the fact that sometimes there is a tendency to re-injure if the disc itself hasn't healed very well. Disc material is like cartilage, just like your knees. Once you start injuring it, it's very hard. It's very difficult to actually come back and heal, because there isn't a very good blood supply.
I'm just going to scale it back for just a second here. So for people who are experiencing back pain right now watching, they might have this kind of disc herniation, and they should obviously see a chiropractor to make sure that they have, they're properly diagnosed. So this kind of treatment, you guys are researching whether this is a more effective treatment?
It has been a more effective treatment, and we're just trying to quantify that, basically. We've noticed that once we added the laser to the spinal decompression protocol, that people were shaving 3, 4, 5 visits.
So right now, you guys are doing a study right now to make sure that this is,
Yeah, we're accepting between 20 and 30 candidates, and basically the way that works is someone would come in with either if they have X-rays or MRI, and we take a look at those. If they don't have that, we're able to send them out for X-rays, and then we take a look and see whether they're a candidate for this study.
So how long is the actual treatment, and how many sessions would they need? Because you mentioned that this actually shaves a few sessions off coming to visit your chiropractor, but how long is it?
Treatments last normally about 30 minutes per session. We do the decompression first and then the laser afterwards. The treatment plan is usually, it's dependent on the person. If they're 100% in 10 visits, that's great, but sometimes average we're getting anywhere between 10 and 20 visits, depending on how severe the case is.
So I'm going to just ask you generally, as a chiropractor, a lot of people might just think, oh, I should go see a chiropractor when I have back pain. Are there any other benefits of visiting a chiropractor?
There are maintenance benefits. It's kind of like changing the oil in your car. If you get yourself adjusted on a regular basis, that's going to decrease the chances, or decrease the aging of the spine over time.
And what would be an adjustment? Like straightening the spine?
It can be a number of things. There's a number of different methods. There's manual methods, which is a traditional chiropractic. Something called activator method, where we use an instrument to help get the spine moving properly. And now with the spinal decompression, it's great for people who were maybe leery of coming to a chiropractor, because it's something that is completely outside of what chiropractors normally did. So there's no cracking involved. It's all just basically just a stretching, very comfortable, and people sometimes even tend to fall asleep during treatment. It's that comfortable.
That's great. Now I'm just I'm curious on how long the study has been happening, and have you seen an increase in people coming into your office requesting the decompression?
Definitely. We've been the study is just actually beginning, so that's one. And the reason we're doing that is once we started adding the laser, we noticed how much quicker people were getting better. So we really want to, we actually had a request from the company that manufactures the laser to quantify this for them and for us. So
Oh, it's very popular then.
We've got about a minute left. I just want to ask a general question in terms of people and their backs. I mean, I know from you sitting here, I kind of feel like I have to sit with the proper back posture right now because I was going to correct me.
I didn't even think about that.
But other than that, for example, how do people hurt their backs? What are the common causes of that, and how can people prevent that?
Lifting improperly. Actually, I would say that the biggest one is losing flexibility. If once you start to lose flexibility, that's when a lot of the time when the back problems start. If the joints aren't moving properly through their normal range of motion, muscles become tight, and that's how you get pinched nerves. That's how you get strains, and that's how you get these disc injuries.
Great, Doctor. Well, thank you so much for coming and talking to us.
Thanks for having me
about
on.
this great study. Of course, they are looking for patients, so www.drjagger.com is where to check it out. We'll be back after these messages to come.